You know, that feeling, right? You've just left a doctor's appointment, maybe feeling a bit drained, but also relieved that the hard part, the getting poked and prodded, the waiting room shuffle, is finally over. You're ready to put it behind you. And then a few weeks later, it hits your mailbox, or maybe it pops up in your inbox, a medical bill. And suddenly that feeling of relief just, well, it evaporates, replaced by this wave of confusion, maybe even a little anxiety. You're staring at this mysterious statement. It's like a jumble of codes and numbers, and all you can think is, what exactly am I paying for here? And why does it feel so incredibly complicated to understand? Well, today we're taking a deep dive into precisely that moment. We're going to unravel something really vital, yet often overlooked, that underpins this entire interaction. The patient statement process in medical billing. This isn't just about getting a piece of paper that says you owe money. It's actually a critical multi-step journey. It meticulously connects your healthcare provider to you, the patient. On the financial side, it's kind of the final act in a complex financial play that begins the moment you receive care.
That's exactly right. And this whole process, it's a foundational pillar of what's known in the industry as revenue cycle management, or RCM, for healthcare providers. And for those less familiar, RCM isn't just billing, it's the comprehensive system healthcare providers use to manage all the administrative and clinical functions that contribute to capturing, managing, and collecting patient service revenue. So essentially, it's everything from, scheduling your appointment, verifying your insurance, all the way through to the final payment collection. The patient statement process is that critical final stage within RCM. Its job is making sure that after your insurance has done its part, any remaining financial responsibility isn't just collected, but also clearly, accurately, and, well, professionally communicated to you. Our sources for this deep dive, they lay out the entire step-by-step journey of these statements. They highlight the best practices that genuinely distinguish the really good providers, and they even pinpoint the common issues that can derail the whole thing, and that can cause a lot of frustration for both patients and providers.
Yeah, absolutely. So our mission today is to really unpack this often confusing process from beginning to end. We want to give you a shortcut to being truly well-informed, maybe illuminating some surprising facts that might just change how you view your next medical bill. It's about helping you understand exactly what happens behind the scenes with those medical bills, turning a moment of potential confusion into a moment of clarity. So let's begin to unpack this. Okay, so let's set the stage. You've received medical care, maybe a routine checkup, a specialist visit, or even a procedure. You've gone home. And eventually, the insurance claim for that service has been processed and paid out, or at least a portion of it has been paid by the insurer. What happens next? This is precisely where the patient statement process truly kicks in, right? It's basically the final leg of the financial journey for a healthcare service. It closes that loop between the provider, your insurer, and ultimately you.
Precisely. Once those insurance payments have been meticulously posted to the provider's accounts, and that posting itself is a key step. Any remaining balance must then be accurately communicated and collected from you, the patient. And that remaining balance, it can stem from a whole variety of factors. It could be a standard copay that maybe wasn't collected when you checked in, or it could be the part of your deductible you haven't met yet for the year, or your coinsurance responsibility, that percentage you pay. Or it could even be for services that your specific health plan simply doesn't cover at all. What's absolutely critical to understand is that this isn't just like an arbitrary admin task of just churning out a piece of paper. No. It is a highly structured and often complex procedure designed for, well, precision, clarity, timeliness, and professionalism. The ultimate goal is to make sure that you, the patient, fully comprehend exactly what you owe and, just as importantly, why you owe it.
I often think of it like a carefully choreographed dance,
Hmm.
where every step has a specific purpose, and if one step is missed or done badly, the whole performance can fall apart. There are several key movements involved in this financial dance, all aiming towards one goal. First, figure out exactly what you owe. Then, generate a transparent statement based on that calculation. Then, get that statement efficiently into your hands. And finally, handle the payment and any necessary follow-up. On the surface, it might seem straightforward. A bill arrives, you pay it. But when you really peel back the layers, you find there's a tremendous amount of precise calculation, meticulous data handling, and strategic communication going on behind the scenes, all to ensure that bill is accurate and the whole process is as smooth as possible for everyone involved. It's truly a complex choreography. Okay, this is where the dance gets really intricate and frankly where many of us feel a significant amount of confusion. That number at the bottom of the statement, that final amount you're supposed to pay, how is it actually calculated? Because it definitely doesn't feel like a random leftover amount, but sometimes it feels like it just, magically appears out of nowhere, doesn't it? So,
Ha! Absolutely not magical, though I totally get why it can feel that way. In fact, figuring out your exact financial responsibility after your insurance claim has gone through what's called adjudication, that's probably the most crucial and complex step in the whole patient statement process. And adjudication, just for clarity, is essentially the insurance company's formal review of your claim. They decide what they'll pay for the services you got based on your specific policy. Once they make that decision, the medical billing system meticulously calculates what you, the patient, owe. And it does that by taking into account several distinct factors, which are, quite frankly, often the main sources of confusion and surprise for patients. This is really where understanding your own insurance plan becomes absolutely paramount. So let's break down those core pieces of info that feed into this calculation. First, there are the insurance payments. This is the precise dollar amount your insurer actually paid directly to the healthcare provider for the service. Simple enough. Then we have adjustments, often called write-offs. And here's a surprising fact many patients don't realize. The initial charge you see on your bill, that's often never the amount anyone, not even your insurance, is expected to pay.
Really? That's huge.
Yeah, it's thanks to these adjustments. They represent contractual agreements between the healthcare provider and your insurer. Essentially, the provider agrees not to charge the patient for a certain portion of the original billed amount. This is a common source of aha moments for patients. It explains why that initial charge might look terrifyingly high, but the amount you or your insurance actually pay is much lower. It's all part of those pre-negotiated rates. Okay, next up, we consider denials. If any part of your claim was rejected or, deemed not covered by your insurance, maybe they thought it wasn't medically necessary or it was for a non-covered service, that part might then fall to you. We also have to factor in deductibles. That's that specific out-of-pocket amount you have to pay for covered healthcare services before your insurance company even starts chipping in.
Right, the amount you have to hit first each year.
Exactly. If you haven't met your deductible yet, more of the bill is going to be your responsibility. Then there's coinsurance. That's your share of the cost, calculated as a percentage of the allowed amount, not the original charge. For example, your plan might say you pay 20% coinsurance after your deductible is met. So if the allowed amount for a service is $100, you pay $20. And finally, copays. Those are the fixed amounts you typically pay for a service right when you receive it, like at the doctor's office. If for some reason a copay wasn't collected up front when you were there, it'll be added to your statement later.
Okay, let's make this really concrete with an example straight from our sources, because I think seeing the numbers really clarifies this whole complex dance. I imagine a total medical charge for a service was, say, $2,000. Now, your insurance, because of their contract with the provider, only allowed $1,800 for that specific service. That's a key distinction right there. The allowed amount is the maximum the provider can actually seek payment for because of those contractual write-offs we just talked about. So out of that allowed amount of $1,800, your insurance then paid $1,500.
Okay, so let's trace this. The initial charge was $2,000. But because of the provider's contract with the insurer, they can only allow or expect to collect $1,800 for that service. That immediate $200 difference, $2,000 minus $1,800, that's your adjustment or write-off. You'll never be charged for that part. It effectively reduces the bill down to the contracted rate.
Got it. So the bill effectively starts at $1,800 now.
Exactly. Now, from that allowed $1,800, your insurance paid $1,500. So if we take the allowed amount of $1,800 and subtract the $1,500 insurance payment, that leaves exactly $300. That $300 is your patient responsibility. That piece covers your deductible amount, maybe your coinsurance percentage, or any copays that weren't collected earlier. It's a perfect illustration of how all these different factors, the original charge, the allowed amount, the insurance payment, those adjustments, they all chip away at that initial figure to arrive at your final personal bill amount.
Wow. Okay. That makes so much more sense when you break it down like that, showing how the allowed amount becomes the new baseline, not the original charge. This complexity, as you can see, really highlights why those initial estimates you might get from a provider before a service can be so tricky to pin down accurately.
Right. They often don't know exactly what the insurance will allow or pay yet.
And it also explains why the final bill can sometimes come as a significant surprise to patients. Perhaps most importantly, it really underscores the critical importance of you, the patient, truly understanding the specific details of your own insurance plan, especially your deductible status, your coinsurance rates, and your copay amounts. Knowing these numbers beforehand gives you a much better predictive understanding of your potential out-of-pocket costs. It lets you anticipate rather than just react when the bill arrives. Okay, so once your financial responsibility is precisely determined through that complex calculation we just walked through. The next crucial step in this financial dance is generating the actual statement, that piece of paper or maybe the digital document that lands in your hands. So as patients, what should we really be looking for on these documents to truly understand them? Rather than just feeling like we're looking at, I don't know, hieroglyphics or some indecipherable code, what makes a good statement?
That's such a vital question. Because a well-designed patient statement isn't just a demand for payment, it really should function as a comprehensive, easy-to-read summary of the services you received and your resulting financial obligations. Our sources detail the crucial sections that absolutely must be included to ensure maximum clarity and transparency for you, the patient. Think of it like your roadmap to understanding the charges. A good provider makes that map as clear and easy to follow as possible. So let's walk through these key sections in detail. First, prominently displayed, usually right at the top, you should always find your patient information. This includes your name, your unique patient ID number, that's important for billing inquiries, and your current address. This is essential not just for accurate delivery, obviously, but also for you to quickly confirm, yep, this bill is actually for me and not someone with a similar name. Next is the date of service, DOS. This is incredibly important. You need it to cross-reference with your own personal records or your appointment calendar. It tells you precisely when the medical service was provided. This helps you recall the specific visit and the context for the charge, especially if it's for a service from, say, months ago.
Yeah, that's crucial. I've definitely gotten bills months later and thought, wait, what was this for again?
Exactly. Following that, you'll see provider details. This is simply the name of the clinic, hospital, or the specific physician who rendered the service. Again, it's about clear identification of who is actually billing you.
And then comes the part that often causes the most head-scratching, but it's so important to scrutinize: the description of services. This section really needs to be exceptionally clear, doesn't it? It should include the procedure codes. Those are those universal CPT or HCPCS codes that precisely describe every medical, surgical, and diagnostic service performed.
Right.
But crucially, it should also offer a clear, plain language description of the service performed. This helps you understand exactly what you are being billed for. It translates the medical jargon into something digestible. This isn't just about a code. It's about connecting the service you actually received to the line item on the bill. It's where the medical care meets the financial obligation, right there on paper.
Precisely. And directly related to that are the charges. This is the original billed amount for that specific service before any insurance payments or adjustments are applied. It gives you the starting point. Then you'll see the insurance payments. This shows the precise dollar amount your insurer has already paid towards that specific line item on your bill. Very important. Following this, you'll find adjustments, which, as we discussed earlier, are any of those contractual write-offs or discounts applied based on the agreement between your provider and your insurance company. This is where that difference between the initial charge and the allowed amount is transparently accounted for. It shows you what you're not responsible for. And then the grand total that matters most to you, the patient. Patient responsibility. This is the remaining balance that you, the patient, now owe. This is your bottom line for that particular service or statement, the ultimate amount you need to pay. Finally, a truly well-structured statement will always include clear payment instructions. It should detail how and where to make your payment, outlining all the accepted methods like online portals, mail, or phone, and, critically, contact information for the billing department. A prominent phone number or email address so you can reach out easily if you have any questions, disputes, or just need clarification. Our sources also mention some optional but incredibly helpful notes that can significantly improve the patient experience. These might be things like clear due dates, information about available payment plans if you can't pay the full amount at once, or even mentions of prior reminders that were sent. All of these little extras are designed to aid in timely payment and dramatically reduce patient confusion. They foster a sense of control rather than, bewilderment.
It's truly fascinating how much detailed information is packed into these statements when they're done correctly. Understanding each section now, after this deep dive, really empowers you, I think, to read your bills with so much more confidence and clarity. It helps transform that overwhelming feeling of information overload into a sense of capability. It turns a mysterious document into something you can actually comprehend, manage, and even question if something doesn't look quite right. Okay, so the financial responsibility is meticulously calculated. The statement is generated with all those clear sections we just discussed. Is it immediately sent out into the world then? Or is there a crucial quality control step first? Like, does someone actually look at it? And beyond that, how are these statements actually reaching us in this modern, increasingly digital age? Are we still just waiting for the physical mail, or has the mailroom, so to speak, evolved?
That's an excellent progression of questions because, yes, there absolutely is a crucial review process before anything goes out the door. And then, yes, there's been a fascinating and really rapid evolution in how these statements are delivered and consequently how payments are collected. It's a vital blend of human oversight and technological advancement, all aimed at accuracy and efficiency. So let's talk about statement review and approval. Before any statement is dispatched, billing staff are tasked with a vital accuracy check. They meticulously review statements. They're looking to ensure there are no duplicate charges, that your address is absolutely correct, and that the explanation of charges is as clear as possible. This is where human oversight plays such a critical role. It catches potential errors that, if missed, could cause immense frustration and costly disputes for you, the patient, down the line. What's also increasingly common, and really a sign of a sophisticated system, is that some billing platforms are now designed to automatically flag statements with particularly large balances for additional manual review.
Oh, interesting. Like an extra check for big bills.
Exactly. It adds an extra layer of scrutiny, ensuring that substantial bills are doubly checked for accuracy. The implication of this step is profound. It's vital for patient satisfaction, and it actively prevents unnecessary disputes. Ultimately, it speeds up the payment process because you receive an accurate bill from the start.
That proactive accuracy check seems like a real game changer. An ounce of prevention is indeed worth a pound of cure, especially with something as sensitive as medical bills. So once it's approved and ready to go, how does it actually get to us? What does the modern mailroom look like for medical statements these days, and what does that mean for the patient experience?
Well, the landscape has definitely expanded significantly beyond just the physical mailbox. Traditional mail still remains a common and necessary method, of course, particularly for individuals who may not have easy digital access, or those who simply prefer receiving paper statements for their budgeting or record keeping, or maybe in cases where digital consent just hasn't been obtained. However, the digital alternatives are truly transforming how you interact with your medical bills. They offer much greater speed and flexibility. For instance, email is now a very prevalent option. If you've given consent, statements can arrive directly in your inbox, often with secure links to view the details, protected by, strong encryption. But perhaps even more impactful are patient portals. Many healthcare practices, especially those using advanced electronic health record systems, or EHRs, offer integrated patient portals. You might recognize names like MyChart, which is used by many systems like Epic. These are incredibly secure, personalized online platforms. And you can not only view your bills and payment history there, but often also access your medical records, schedule appointments, communicate securely with your provider, manage prescriptions.
All right, they put everything in one place.
Exactly. They centralize so much of your healthcare information in one secure location. And then we have even more immediate options, like SMS links. Some systems can actually send text notifications directly to your phone with a secure link, allowing you to view or even pay your bills right from your mobile device. The analysis here is pretty clear. These digital options offer unparalleled speed and convenience. It reflects a broader trend in healthcare toward patient self-service and immediate access to their information. It puts more control directly into your hands, and it can potentially reduce delays in payments simply by making it easier to receive and act on the bill.
That really changes the game, doesn't it? Offering that flexibility and immediate access. So once that statement reaches us, however it gets there, and we're ready to pay, how does the payment collection process close the loop? What are the options, and what happens on the provider's end once we pay?
Yeah, closing the loop effectively is all about providing multiple convenient avenues for payment. It needs to reflect consumer preferences in an increasingly digital world. Patients now have a much wider variety of ways to settle their bills. Online payment portals have become increasingly popular, they're secure, they're often available 24/7, and they allow for quick transactions using credit cards, debit cards, or even direct bank transfers, CCH. But if you prefer or need other methods, you can still usually pay over the phone with a credit or debit card by speaking to billing staff. You can almost always send a physical check via mail, or even pay in person at the provider's office, though that's becoming less common. Once the payment is made, it's then posted to your account on the provider's side. This can be done either manually by billing staff who reconcile the payments with the outstanding accounts, or increasingly, it's done electronically through integrated systems that automatically record the payment and update your balance in real time or near real time. The relevance of offering these diverse payment options is critical. It directly impacts how quickly providers receive payment, and maybe more importantly for you, it dictates how convenient and stress-free the entire process is. The easier it is for you to pay, the more likely you are to do so promptly, which reduces the need for all that follow-up stuff we're about to talk about.
Okay, so we've covered the entire journey from service to statement delivery and ideally payment. But what happens if a patient doesn't pay within that initial time frame? It's not just a one-and-done bill that simply disappears if you ignore it, is it? It feels like there's a whole system for when things don't go perfectly, and often that's where the real stress begins for patients.
You're absolutely right. It's definitely not a single bill and then done. The process has built-in mechanisms for follow-up, which can and often do escalate over time. This is a really crucial point where the provider's financial health, their ability to keep their doors open, pay their staff, continue providing quality care, it intersects with potential financial challenges or even simple confusion on the patient's part. It's a very delicate balance to manage effectively and empathetically. So let's walk through the follow-up cycle for non-payment. Typically, if payment isn't received within a set initial period, commonly around 30 days from the statement day the process begins. This isn't usually an immediate aggressive step, though. Instead, subsequent statements are commonly sent out at intervals. Our sources indicate that second and third statements are frequently dispatched at around 60 and 90 days, respectively. These function as gentle but firm reminders, just reiterating the outstanding balance and the due date. They're designed to prompt payment without immediately resorting to more severe measures. Now, if allowed by the provider's clearly stated policy, and this really must be clearly communicated on the statement itself, and in-patient agreements upfront late fees may also be applied. These act as a further incentive for timely payment, though, honestly, many providers prefer to avoid this if possible, just to maintain patient goodwill.
Yeah, I can see how late fees might not feel great.
Right. Beyond just sending more paper, collection calls often become part of the strategy. Billing staff might make direct phone calls to patients to discuss the outstanding balance. The goal here shouldn't just be to demand payment. It's also a critical opportunity to understand any issues or challenges the patient might be facing. Maybe there's genuine confusion about the bill. Maybe there's a dispute over the charges. Or perhaps most importantly, maybe there's a genuine inability to pay the full amount right now. This human interaction can be crucial for resolving issues before they escalate, maybe by offering solutions like payment plans. However, if these repeated attempts at collection fail, and importantly, only after proper advance notice has been consistently provided to the patient, often detailing the impending action, the account may be escalated. This escalation typically means the account is sent to a collection agency. They then take over the effort to retrieve the funds, and that's a situation that can unfortunately negatively impact a patient's credit score. Alternatively, and this is a significant financial decision for the provider, they might choose to write off the balance as bad debt. This means they effectively give up on collecting that amount. They absorb it as a loss, which directly impacts their bottom line, their revenue.
Wow, it sounds like an immense amount of effort goes into trying to recover these funds before reaching that final collection agency step. Which makes sense, given the impact on providers. But what about when we, as patients, have questions or think something might be wrong with a bill? What's the process for patient inquiries and disputes? Is the billing team truly trained to be like, customer service reps in these often sensitive financial conversations? Because that feels really important.
They absolutely should be, and our sources heavily emphasize this point. The billing department very much functions as a crucial customer service arm of the healthcare provider. Their role is far more than just collecting money. Patients frequently contact the billing department for a whole variety of valid reasons. They might call to dispute charges they genuinely believe are incorrect or don't pertain to them. Maybe they see a service listed they know they didn't receive. They often seek clarification on confusing line items or those procedure codes that just don't make sense on the statement. They're asking for plain language explanations. Sometimes they need to request itemized bills for more granular detail. Maybe they're trying to understand specific costs, verify services accurately, or even justify them for tax purposes or other claims like flexible spending accounts.
Right, for FSA or HSA reimbursement?
Exactly. And crucially, patients often call to ask for payment plans if they find they simply cannot pay the full amount at once. This is such a critical service. It allows patients to manage their financial burden over time in a structured way. Because of this constant and often sensitive interaction, our sources strongly emphasize that billing teams must be exceptionally well trained. They need to handle these queries politely, empathetically, and efficiently. This isn't just about the mechanics of collecting money, it's profoundly about customer service and, perhaps even more importantly, about maintaining patient trust. Think about it. A financial dispute or just a perceived lack of clarity can quickly sour a patient's entire perception of a healthcare provider, even if the medical care itself was absolutely excellent. A well-handled inquiry, on the other hand, can actually prevent an account from being sent to collections, which is a stressful and potentially damaging situation for everyone involved. More broadly, it helps to maintain a positive, ongoing relationship with the patient, even when the financial situation is challenging. It shows the provider cares about the patient's overall well-being, not just their payment. And that fosters loyalty and contributes to a much better overall patient experience.
Okay, so after exploring all the intricate steps and, well, the potential hurdles, what truly sets a really effective patient statement process apart from a mediocre or even a bad one? What are the gold standards that healthcare providers should genuinely aim for to make this entire experience smoother and more transparent for everyone involved, both for them and for us, the patients?
That's an excellent question, and our sources highlight several key best practices that, when implemented consistently, really do make a huge difference. They not only significantly improve revenue collection for providers, but also dramatically enhance the patient experience. It's truly a win-win scenario when done right. It can turn what's often a point of friction into an actual opportunity to build trust. Okay, first and foremost, providers should use clear and simple language on their statements. This might seem incredibly obvious, but you'd be surprised how often it's missed. Avoiding medical jargon and overly complex billing terminology reduces confusion, and reduced confusion directly encourages faster payment. If you understand what you're paying for, you're far more likely to pay it promptly and without calling for clarification. Imagine receiving a bill with CPT 99214 versus one that says office visit moderate complexity. The second one is immediately understandable.
Makes total sense.
Secondly, offer multiple payment options. This is entirely about increasing patient convenience and just removing barriers to payment. The more ways a patient can pay, whether it's online via a secure portal, over the phone, by mail, maybe even text to pay, or through digital wallets, the easier it is for them. And easier equals quicker payments. For example, a clinic that allows text to pay or integrates smoothly with Apple Pay or Google Pay often sees a higher on-time payment rate. Thirdly, and this is surprisingly crucial for maintaining a healthy revenue cycle, providers need to send timely statements. This seems like a no-brainer, right?
You'd think.
Yeah, but prompt billing isn't just about improving cash flow for the provider, though that's important. It also ensures that you, the patient, receive the bill while the service is still relatively fresh in your mind. Long delays can lead to forgotten services, confusion about the charges, what was this again, and increased resistance to payment. If a bill arrives 6 months after a routine checkup, it's much harder for a patient to recall the details and just process it smoothly. Fourth, enable robust online billing portals. In today's digital world, this is almost a necessity, not just a nice to have. It speeds up payment collection significantly. And perhaps more importantly, it gives patients more control and immediate secure access to their own financial information and statements whenever they need them, 24/7, without waiting for mail or calling during business hours. Many patients really want to self-serve these days. Fifth, and I really cannot stress this one enough, providers must provide genuinely good customer service within their billing department. This is paramount. A helpful, empathetic, and knowledgeable billing team builds trust and patient satisfaction, even when they're discussing potentially sensitive financial matters like outstanding balances. They can de-escalate disputes effectively, explain complex insurance explanations of benefits patiently, and proactively offer solutions like payment plans. This reinforces the idea that the provider cares about the patient's overall well-being, not just collecting the money. It can turn a potentially negative interaction into a positive one. And finally, a more technical but critical practice. Track statement delivery and response. This helps with proactive follow-up. It helps providers identify if a statement was never received, maybe the mail was returned, or if there's a pattern of non-response from certain patients. This allows them to address issues before they escalate into larger, uncollectible balances. This data allows for much more targeted and effective follow-up efforts rather than just blanket reminders.
Yeah, it's crystal clear that adopting a truly patient-centric approach isn't just a feel-good measure. It's profoundly good business for healthcare providers. It transforms what can often be a confusing and stressful interaction, just getting a medical bill, into something much more manageable, transparent, and ultimately more trust-building for the patient. It's about building a partnership, really, even on the financial side, by valuing the patient's understanding and convenience. Okay, so on the flip side of those best practices, where do things commonly go wrong in this patient statement process? What are the biggest, most frequent pain points that emerge? For both patients who are just trying to understand and pay their bills, and for the providers who are trying to get paid for the services they delivered. Because we know it's not always a smooth operation, despite everyone's best intentions.
You're absolutely right. Despite best intentions, and even with sophisticated systems sometimes in place, several common issues can significantly derail the patient statement process. And these pitfalls often lead to frustrating delays, increased administrative burden for the provider staff, and ultimately, lost revenue. Understanding these common problems is absolutely key to avoiding them. One of the most prevalent and seemingly simple issues, but one with really profound impact, is incorrect patient information. This might just seem like a basic data entry error, but its consequences are substantial. Incorrect addresses, maybe misspelled names, outdated phone numbers or email addresses, these lead directly to returned mail or bounced emails, meaning lost statements.
Right, the bill never even arrives.
Exactly. Imagine moving and diligently updating your address everywhere else, but that one crucial detail isn't updated in the clinic's billing system. Suddenly, you're getting collection calls for a bill you never even saw. This causes significant delays in payment, obviously, but it also requires a substantial amount of additional administrative effort from the billing staff. They then have to manually track down the correct details, verify them, maybe call you, and then resend the statements. It just wastes valuable time and resources. Another major pain point, and one patients complain about a lot, is a confusing statement format. If a statement is difficult to understand, if it's packed with impenetrable medical jargon or codes, if the layout is illogical, or if it doesn't clearly show how the patient responsibility was calculated from the insurance payments and adjustments, it naturally leads to significant delays in payment. Patients simply don't know what they're paying for, how much they really owe, or how to pay it. They might even assume it's an error and just set it aside.
Or just call the billing office, adding to their workload.
Precisely. This directly results in a sharp increase in patient inquiries to the billing department, which ties up valuable staff resources. And most importantly, it generates immense frustration and distrust for you, the patient. It completely defeats the entire purpose of clear financial communication and puts an unnecessary burden on both sides. In today's digital age, a particularly significant issue can be the lack of convenient online payment options. If a provider doesn't offer a secure, user-friendly online portal or other digital payment methods we talked about, like text-to-pay or integration with mobile payment apps, it means they are missing out on potentially quick, convenient payments. Many patients today prefer, or even expect, to be able to pay their bills instantly from their phone or computer, often outside of traditional 9 to 5 business hours. Not providing this option can definitely deter some patients from paying promptly, or maybe even at all. It leads to unnecessary delays in revenue collection. It's just a fundamental disconnect between how people prefer to manage their finances today and how some healthcare providers are still facilitating that. And finally, a critical systemic failure that can be really catastrophic for a provider's finances is having no robust follow-up system. If there isn't a clear, consistent, and proactive system for following up on unpaid balances, those subsequent statements, the polite calls, the reminders we discussed, then these amounts can quickly escalate. Small, unpaid balances can accumulate over time into larger sums. And eventually, these amounts can become essentially uncollectible bad debt. This directly impacts the provider's financial stability. It can hinder their ability to invest in new equipment, hire enough staff, or maybe even keep their doors open in extreme cases. It's a powerful reminder of how seemingly small administrative details can have truly significant, far-reaching consequences.
Yeah, each of these issues, when you look at them, really creates a significant ripple effect, doesn't it? It's not just about the individual transaction or whether one single bill gets paid on time. It impacts the overall financial health of the healthcare provider, which can hinder their ability to deliver care and innovate. And for us, the patients, it erodes trust in the healthcare system as a whole. It transforms what should be a necessary interaction into a source of stress, confusion, and sometimes even anger. It's a powerful reminder of how seemingly small administrative details can have truly significant, far-reaching consequences for both patients and the entire healthcare ecosystem. So we've journeyed through the entire patient statement process today. From the initial service to the intricacies of the billing calculations, the statement delivery, the payment methods, the follow-up strategies, and all the factors that influence what you ultimately pay. It's truly far more complex and nuanced than just, a bill arriving in the mail, isn't it? It's a really dynamic and absolutely essential part of the overall healthcare experience.
Exactly. Our deep dive today has vividly shown that the patient statement process is not just some administrative formality. It is a vital, indeed an indispensable bridge. It connects healthcare providers and patients within that larger, often bewildering medical billing cycle. A well-structured, patient-centric process isn't merely about the mechanical act of collecting money. Far beyond that, it fundamentally ensures that patients genuinely understand their financial responsibility. It fosters a sense of clarity rather than confusion. This, in turn, significantly improves patient satisfaction, which is invaluable for providers in today's competitive landscape. And as a direct consequence, it ultimately enhances revenue collection for healthcare providers, allowing them to continue their crucial work of delivering care. It truly is a crucial element in fostering greater transparency and building that essential trust within healthcare finance. Hashtag tag outro. Thinking about all these moving parts we've explored today, the complex calculations, the various communication methods, the critical human oversight needed, and the rapid digital advancements happening, it really raises an important question, doesn't it? Given the inherent complexity and the undeniable importance of this process for both patients and providers, how might technology continue to evolve the patient statement process in the years to come? How can we make it even more intuitive, even more immediate, and perhaps most importantly, even more empathetic for the patient? What's the next frontier for ensuring financial understanding in healthcare? How do we shift it from what is often a significant point of friction to a genuine moment of clarity and empowerment for patients?
That's a truly thought-provoking question, and one we hope you'll continue to ponder as you navigate your own healthcare journey. Thank you so much for joining us on this deep dive into the fascinating and yet sometimes frustrating world of medical billing statements. We sincerely hope you now feel much more informed and indeed more empowered the next time you receive a medical bill. Until next time, keep learning, keep questioning, and keep exploring.